Let's see. And hello, I should introduce myself. I'm Hao Yi. I am the reproducibility librarian at the University of Florida Health Science Center Libraries. And I believe our speakers are here and ready to go. So first up, Daniel Dunleavy is going to talk about the title of their talk, Towards Reproducible Social Work Research, a graduate course on reproducibility, rigor, and meta-science.
All right. Thank you, Hal. I'd also like to thank Melissa and Katie and the rest of the people who have put in the hard work over the last few months to put this conference together. Hal, please chime in if there's any technical issues, people can't see the PowerPoint or can't hear me well or anything. The title of my presentation is Towards Reproducible Social Work Research, a graduate course on reproducibility, rigor, and meta-science. So first, I'll give you just like a quick overview of what I'm going to cover in my talk. So I'll give you a little information about myself and my co-author for this presentation, Jeffrey Lacasse. I'm going to tell you a little bit about the social work profession, as I'm pretty sure that most people who are attending this session or the conference in general are not from social work or may not have worked directly with social workers before. I'm going to spend a little bit of time talking about the role of research within social work practice and social work academics. Then to kind of contextualize everything, I'm going to give a little information about how social work is structured in terms of undergraduate, graduate, and doctoral education. And then I'm going to tell you about this course that I'm proposing that I'm throwing together. I'll go through each of the kind of sections or modules that I've detailed and go into a little bit of the different assignments that I've crafted for this course. And I'll note from the beginning that in a lot of ways, this course is still in development. So I'm interested to hear other people's experiences, whether within social work or adjacent disciplines, with undergraduate, graduate, or doctoral education. And I'm happy to receive plenty of feedback on this. And then we'll take some time to do some Q&A, and I'll share my contact info with you all again. All right, so who am I? I'm Daniel Dunleavy. I'm a PhD in social work and a clinical social worker by training. I graduated from Florida State University in the summer of this year, and I'm currently a postdoctoral research fellow in the College of Medicine at Florida State University. So I'm working in the Center for Translational Behavioral Science, primarily doing a lot of public health research around chronic disease, medical marijuana. My home research is around behavioral health care, so substance abuse and mental health conditions. But as I developed as a scholar, I took an increasing interest in these kind of discourses that were happening in fields adjacent to social work. So fields like psychology. So as I developed as a scholar, I took an increasing interest in issues going on in adjacent fields around meta-research, which was the topic of my dissertation, statistical inference, reproducibility, replicability, and the like. You can find real quick my contact information, both email and I'm on Twitter fairly frequently, and I'll post those again at the end of the presentation. Okay, so a little bit about the field of social work. So, for people that aren't familiar with social work, and particularly social work in the US, I guess the first thing that comes to mind for many people is this idea of, the child welfare system, the foster care system, children being removed from families. And while that is a very large part of the social work profession, social work encompasses much more than that. So broadly speaking, social work can be conceived of as a profession that's largely concerned with helping society's most disenfranchised, people that have been disempowered or marginalized, who are particularly vulnerable to discrimination, abuse, and so on. Social workers work in a variety of settings. They can be found in schools, and hospitals, and homeless shelters, the child welfare system, veterans affairs clinics, in parts of the legislative branch of state, local, and federal governments, and really in many other places. And the profession has formally been around for about 140 years now, starting in the inner cities of the US and parts of the UK. As these cities were starting to become more densely populated, social workers stepped up to help people who may have migrated to these cities, but who might not have been able to find employment, or who, through death of a spouse or family members, had no one to look after them, or to the immigrant population that would be coming to these large cities, who would need help finding their way around and being integrated into society. As a scholarly field, and as a professional field, social workers work with a variety of other disciplines. We're highly disciplinary, working with people in the medical community, whether it be physicians and doctors and psychiatrists, whether working with kind of our sister profession of psychology, or working with sociologists or other people in the humanities. Okay, so a little bit about the role of research in social work practice and social work scholarship. So social workers across the board, whether they're students coming out of their bachelor's programs and going into the field, or whether they're academics or social workers that affect legislative or policy decisions, research is a central aspect of their daily work. So we might use it to inform our decision making. What should I do with this client who's come into my office, who has this particular sets of problems? So, for instance, in my own clinical practice experience, I might have a client come in who didn't match what I learned in a textbook, who had difficulties with a variety of substances, whether it be alcohol and marijuana and methamphetamines, or maybe it had some sort of comorbid condition, problems with symptoms of schizophrenia, but also comorbid drug use. So social workers like myself in that situation might have to refer to the literature to digest it, to know how to integrate it into their practice, to help inform their decision making with that client. Similarly, social workers work in legislative branches of government, and in offices that help provide social welfare services. So that, whether that be in Florida, something like the Office of Human Health Services, or the Medicaid and Medicare branch, or parts of the government that define what it means for a child to be abused. Social workers in each of these different contexts rely on the research literature to inform those decisions and those proposals that they put forward. As an academic discipline, social workers routinely conduct research to build evidence base for these decisions that have to be made, to help us understand various social problems, and to think about different interventions aimed at ameliorating them. So thinking about what is the most effective treatment for a client with comorbid conditions? How do I help somebody who is a homeless single mother? How do I get them into long-term housing, and so on and so forth? So despite this kind of integral role that research has in social work across these different levels, social work hasn't really seriously kind of reckoned with the literature over the last 8 or 10 years, discussing problems with reproducibility and replicability. Save for a couple of articles in prominent social work journals, one in 2015 by Matthew Howard and Eric Garland, and one in 2019 in the Journal of Social Work Education. discussions of replication or a replication crisis are relatively non-existent. And this has, as you can imagine, dire consequences if the work that we do is working with some of the most disempowered and disenfranchised and vulnerable people. If we're doing a study on, transgender individuals or single mothers or other vulnerable populations, and we're doing poor research, we're doing a disservice to each of those people who we ask to take the time to fill out our surveys, to enter our randomized trials, and so on and so forth. And that's kind of what led me to this presentation. From my perspective, the most effective way that we can start to improve the way that we conduct research with and with these kind of interdisciplinary teams that we work with is at the educational level. So a little bit about social work education. Like most other degrees, there's a bachelor's level, a master's level, and doctoral level degrees in social work. The kind of terminal degree for practicing social work is the master's level degree. That's the degree that you would attain if you wanted to achieve licensure and be a licensed clinical social worker. So most social workers in the field are either a bachelor's level or a master's level clinician. As you can see, there's a number of programs across the US alone, let alone in Canada, the UK, or other developed countries across the world. In the US, there's about 80 doctoral level programs, each with anywhere between, I'd say, conservatively 10 and 25 students each at any given time. So that's kind of how I arrived at the need for this course. So the course is trying to give students at the graduate level, more primarily aimed at doctoral students, but also at master's students to some extent, kind of a crash course in reproducibility, rigor, and meta science. So the course has 4 main objectives. The first objective is to kind of increase knowledge and understanding of this issue around replicability and this concept of, questionable or suboptimal research practices and how that contrasts with more idealized optimal set research practices. So things around power analysis, sample size planning, p-hacking, harking, and so on and so forth. Another goal of the course is to increase understanding of meta research as a way for helping calibrate and evaluating the type of research that's being done in the field. Third objective is to kind of increase understanding and knowledge about good data management practices. And the fourth goal of the course is to increase knowledge and understanding of research reproducibility, rigor, and other issues specifically catered towards the type of applied research that social workers do, with the types of populations that research will be conducted with. So the course is divided into 8 sections, and they're meant to be distinct and standalone in some ways, but also complementary to one another. So the first 2 modules are trying to just give kind of a crash course in how science can go right and how science can go wrong. So trying to help students understand, how is it that science progresses and knowledge develops? What makes our theories testable? What makes for a good theory? What makes for a poor theory? As well as some issues that might come into play regarding various cognitive errors and biases, so things like confirmation bias and so on. So sections 3 through 8 get a little bit more in depth in the specific issues around replicability and reproducibility. So section 3 offers a crash course in the replication crisis, kind of giving an overview of the last 10 years or so of these issues. And this section predominantly relies on a lot of Chris Chambers' book, 7 Deadly Sins of Psychology, as a nice kind of primer for this area. The next section deals with statistical inference, kind of giving an overview of the different schools of statistical inference, whether it be likelihoodism, Bayesianism, or classical frequentist statistics, honing in specifically on the use and misuse or misunderstanding of frequentist concepts like an alpha level or p-values and how they should be interpreted, a priori power analyses and post hoc power analyses and things like that. Sections 5 and 6 detail questionable research practices, things like harking, p-hacking, selective reporting. Section 6 deals with the sociology of knowledge and science, how our research is disseminated and uptook in different fields. Section 7 details a little bit of meta research, what that is and how it's conducted. And Chapter 8 hones in on specific issues within the profession around reproducibility and research integrity. I have a variety of assignments that I've helped create for this syllabus. I won't go into them now. They are on the website that I've created for this project and this course down here, and on the link for the Open Science Framework. That's where this course is being developed in more detail with a specific set of course readings. And again, here's my contact info if any of you would like it. But now I'm happy to use whatever time's left to jump into any questions that folks might have. Thank you again.
Thank you, Daniel. I have a question. Since your course is aimed at students, we have a question now. Do you talk about evidence synthesis with your students and the evidence pyramid?
Yeah, so this course is still in development. I've taught undergraduate and graduate courses while I was in the PhD program at my university. So, in a typical social work research course, we do talk about, like meta-analyses and systematic reviews and kind of an evidence-based medicine and the different hierarchies of evidence and types of studies that would be comprised of. So this course would touch on that to some extent, including things like, registered reports and like pre-registered meta-analyses and things like that. But it's not aimed to be necessarily a substitute for a good, rigorous methodology course. It's more aimed at being a complement to a good methodology course.
Great, thank you.